Hello, everyone. Welcome back to Public Health Modernization Chats. You just had the opportunity to listen to Love Army, which was done in a collab with the Resistance Revival Chorus. If folks want to check them out, they have some pretty cool stuff. So I hope you enjoyed our intro song today. My name is Heather Redman. I use she, her pronouns, and I'm the Strategic Initiatives Partnerships Coordinator at the Oregon Health Authority. And we've got some other fun OHA staff here with us on camera and a newcomer on camera. So I want to give folks a chance to introduce themselves. Dolly, in tradition, if you could go ahead and kick us off by introducing yourself again. I know the group knows you, and then we'll give Leanne and Kayla a chance to say hello as well.
Sure. Hello and good afternoon to you all. Dolly England, she, her queen. I am the interim equity director as of today. And thank you for coming to a modernization chat. And Heather, that song, I want to send a shout out to all of our friends working at the CDC or Health and Human Services. The last 2 weeks have sucked all around. Sending them some love. And I'll pass it to Kayla.
Hello, I'm Kayla Manning. I work with Dolly and the rest of this crew. I'm a community engagement coordinator, hopefully forever. Um, really excited to be here. I love the mod chats. I will pass it to Leanne.
Hi everyone, so I'm Leanne Miranda. My pronouns are she, her, ella, and I am one of the managers for the equity office. And you will be seeing more of my face during these meetings. So happy to be here.
Awesome. Thanks everybody for taking a chance to share I should say everybody, OHA folks, to share in this space who you are and where you're coming from. So if folks, per usual, would like to share in the chat your name, pronouns if you would like to share, where are you coming from? Where do you work? What communities do you serve? And then I haven't really come up with like a warm-up question. But I think one that we could probably use is what is a way, I was inspired by the music video, what is a way that you are holding on to joy right now? I know that that can be a complicated question. Thank you, Dolly, for the acknowledgement that we're just going through a lot right now in our jobs and our goals and our passion to serve our communities well. And so who are you? Where are you coming from? And what's a way that you are holding on to joy, or you have been holding on to joy so far this year? I think that would be a really great way for us to show up for each other in community today. So please feel free, put in the chat, or if you would like to and something has inspired you to share verbally, please raise your hand or come off mute. And I'll give us a minute or two as we get ready to hear from our first presenter. And I think, Suzanne, I saw your name. Are you here? You are here. Oh my gosh, and your color of your shirt is so joyful. You got the
That's what
memo.
how did you know? That's actually what I was looking for today. I was like, I need some lightness. So,
Love, 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 love. Um, all right, it looks like folks are starting to share in the chat. Thank you for those of you that chose to be brave and go first. Dolly, do you have your hand up?
I
Like,
do have my hand up,
okay,
up.
go.
And I can't say for the year, but I'm going to say for the last 2 weeks. Um, Last week, I was in my feelings the last 2 weeks. I'm not going to lie. And I ate my feelings. And the thing that brought me joy was blizzards from Dairy Queen. And I consumed a lot of those. I'm not going to lie, more than one. And this week, to recalibrate these little tangerines are bringing me joy, and they're much better for my body. So my body is like, girl, thank you, because you don't need all that lactose. So that's what I'm gonna say is bringing me some joy.
Oh, I love that answer. And in case joy of lactose will bring you joy later in the month, I believe that there's a free cone day happening at Dairy Queen this month. If someone wants to help fact check me on that, I'm pretty sure it's April. So folks need some lactose joy later. You can get a free night for free 99. You can get a cone from Dairy Queen, and that sounds awesome. Okay. Let's see. Just want to do a couple shout outs. Folks are saying seeing flowers pop back up has been joyful. Comes from serving community, parenthesis, true statement, smiley face. Love that. Kittens and chocolate. Pretty hard to argue with kittens and chocolate. Yoga practice, car karaoke sessions, working in a garden, and doing a happy dance when people see things growing in their garden. So it's like double joy. I'm seeing a lot of flowers, birds, hearing birds sing. Yeah, it's kind of like the world is like the earth is like waking back up for us and reminding us that um, even though sometimes some of the obvious ways that we know that we are being care for might be harder to recognize, they will come back and they will let us know, hey, I'm still here. Oh, this is so great. Thank you so much for sharing in the chat and for helping to share with community what your joy is today. Suzanne, that's my really awesome segue. Did you like it? Suzanne, are you ready?
I'd love to be associated with joy. Thank you, Heather. Hi, good morning, everyone. I'm Suzanne Cross. I use she, her, aya pronouns. I am happy to be here today. I'm just going to share. I think I only have 10 minutes. Is that correct, Heather? So I'm going to set my timer because I tend to talk a lot. So we gotta, okay. Well, I'll set my timer for 10 minutes. And I really want to welcome questions, but I'm just going to talk briefly about the community capacity building funds grants that, let me pull up my slides. Are you going to share slides? You want me to share my slides, Heather?
If you have got them ready, you're probably going to share them quicker than me. So
Will do.
go
Okay.
for it.
Let me just get the right one. Sorry. And then the share my screen button is down there. Okay. There we go. Okay. Now you can see the presentation. Is it on the cover slide?
I only see you and the participants. Oh, hold on. Aha, I see slides.
Okay, great.
I'm hoping other people can as well.
Yep, I see head nods. Okay, good. Okay, so the Community Capacity Building Funds, the program, for those of you who are familiar with, started last year in 2024. These funds are part of the 1115 Medicaid waiver for HRSN, standing for Health Related Social Needs. And when we had a 2024 grant program, this is the 2025 grant program. This will be the end of the community capacity building funds. Most likely, let's say like 98% sure. They are meant to support organizations who intend to become who are already becoming health-related social needs providers. So these are generally for organizations, and there's certain organization types that are eligible, who basically are starting to enter into the Medicaid system. So we've set up this complex Medicaid healthcare system. And now we're opening it up to these social needs, adding these benefits onto Medicaid, and helping these funds that I'm talking about today help support providers in doing what they need to build up their capacity to become providers inside the Medicaid systems. So I'm going to drop in a bunch of links. Um, there's a link here on this slide that you can see to a webpage about HRSN service providers. And then there's also a bunch of links that I'm going to share in a minute here because I'm not very good at multitasking. But a link to the Community Capacity Building Fund's website and a couple things that I'm going to go through today. So what I want to call out right now is that applications opened up on April 1st. So on, what was that? Tuesday. And that organizations will apply directly to the coordinated care organizations. And that's regardless of whether an organization is going to serve fee-for-service population within that region or CCO members. So what you'd want to do if you're an organization interested in applying is look to the CCO within your region and go through their websites, which we'll pull up in a second here, those links as well. But really learn about what their priorities are for the funding for 2025, as well as the specific steps for applications. And I'll go over that a little bit more in a second here. Let me switch to the next page. Okay, so OHA negotiated with the Center for Medicaid and Medicare Services. Hopefully it's still called that. And we have a protocol that's also linked in these slides. And I'm Heather, please feel free to share out the slides after the meeting. Thanks. This protocol kind of links in the specific allowable uses for these funds. And they're in 4 large buckets: technology, workforce development, development of business practices, outreach, and education. And within these areas, there's, some specific things about what they can be spent, what the money can be spent on. And I'll pull up the application here in a minute, but I want to call out that there's a link to this HRSN protocol. There's also a lot of plain language information within the Community Capacity Building Fund's application, which I'm going to go over in a few minutes. But there's what we did this year is we did a lot of learnings for 2024. Many of you may have been part of our interview process and our survey process. We did a survey out to all organizations who applied for CCBF last year. And we did a survey out to anyone who had attended our informational sessions last year, as well as we asked CCOs about the application, the process, the budget, and what we could do to prepare for this coming year. And a lot of what people said to us was, we need more understanding of what the HRSN services are. We need more understanding about how to use these funds. And we need more just general information within the application itself. So we really tried this year in our design of the application, which also, I want to thank Dolly and her team because we utilize a lot of the public health equity grant application learnings on how to work with CBOs and what makes sense in language to build our CCBF application and improve on it as well. So in the application, you'll see there's a lot of do these things. Here's the links to how you become a provider. Here's the links to the rates, for example. And then you can kind of fill out your so that you know what it is you need to do in order to what you need to ask for when you're filling out the application. I'm getting notices about my VPN. Are my web? I'm good. Okay, good. Okay. So I'm going to pull that up in the application here in a second, but let me move to the next slide, which is who's eligible to apply. So LPHAs, licensed local public health associations are it's not associations, it's agencies.
Authorities.
Authorities. I knew there was an A word. Thank you, Dolly. Local public health authorities are eligible to apply, as well as community-based organizations, social service organizations, government pseudo-government entities, anyone who wants to become an HRSN service provider, which would mean that you intend to provide these housing benefits, the food benefit, or the climate-related benefits, or outreach and education to OHP or fee-for-service members. There's also a set aside for tribal entities, for the tribal governments. They've received a portion of the CCBF overall dollars and are pulling out those funds and deciding how to spend them on their own. And then there's also 2 new eligible entities. They're not new from 2024, but their point clarified a little bit more in 2025, which are hub organizations. So organizations that may not necessarily be providing the HRSN services, but more acting like a hub. So whether they're providing billing services or whether they're providing other services that support smaller entities. So this allows maybe smaller entities who don't have the infrastructure to kind of delve into this whole Medicaid world that maybe want to lean into a larger entity that might work as a hub. Those 2 can partner and apply for CCBF. So, and then the other organization type that's called out this year that's different from last year is the idea of a convener. So that might be organizations that want to pull together other entities to do some planning or to do some collaborating or to do some learning across the organizations. Okay, the next, oops, what have I done? Okay, the next slide is the total amount for this year. You can see it's a bit over $55 million. It's a lot of money. This is the breakout by CCOs. One of the things that we learned last time was that we at OHA were kind of shouting loud and clear about how much money was available, but we weren't being clear that it's depending on the CCOs, the amount. So, or entities were applying for more than the CCO had. So we wanted to make sure to clarify that this year. And also that there was, in the design of these totals, there was a decision to kind of help out the urban rural divide. So there's a base amount of money for every CCO, regardless of whether they're urban or rural. And then the other portion of the CCBF allocation dollars is dependent on enrollment. And all of this should be available also, it is available on our OHA CCBF website, which I'll drop a link into, but also available on each CCO's webpage, which we will continue to suggest folks look at. So here's kind of a step-by-step process. So there is an HRSM provider webpage. The timeline for 2025 is laid out here. As I said, each CCO has a requirement on their webpage to provide a lot of information this year, including where their focus is for the CCBF and including a direct contact link to follow up with. So if you don't see that CCO's focus for their 2025 funds clearly laid out, please reach out to them and ask them for some more specifics. We encourage organizations who are interested in applying to these funds to reach out to the CCO and say, here's what I'm thinking. Can you help me navigate an appropriate application, or can you help me see if this is worth my time, to make sure that you're not wasting your time. And also, please, and I'm going to have our CCBF email in here. There's a few of us who track this email inbox on a regular basis, and we encourage you to reach out to our OHA CCBF team if you have any challenges or you need support, advocating or connecting with your CCO. We'd be happy to do that. The application and budgets need to be submitted by the end of May, by May 30th, which is a Friday. Notice to grantees will go out in September, and grantees will get their funds in September through October, depending on how quickly the CCO gets notified of their awards. OHA approves all their awards. So I just wanted to pull up, let me see if I can navigate this. I wanted to pull up this, the application template and the budget template for you all. Out of here. Oh, there we go. Okay, so I mentioned this year that the application, while it looks long, it's 34 pages, it is actually not. There's a lot of white space that we use large font, and we also did what I explained is this appendices starting on page 25. So page 25 has background and overview information. There'll be links to each type of benefit that you can learn about. There's information about the grant program, how much funding is available. And this really honestly didn't exist in last year's program because the services, the HRSN services, were still being designed. And so this year we have the rules, we understand what the services are that organizations are supposed to be, that organizations and the benefit will be offering, as well as we also have all the fee schedules that are updated on a regular basis. And there's a link to those as well. So organizations can understand once the CCBF, what they'll get reimbursed from the CCO for providing these benefits is. And then again, step-by-step information. Really important is what I mentioned earlier on page 28 is what can the funding be used for. I want to call out something that's come up regularly. Unfortunately, CCBF cannot be used for overhead admin fees. So that kind of typical 10 to 15, sometimes 25% that organizations are used to applying for grants and putting in overhead for admin fees. That's not allowed through our protocol with CMS. And so, but there are places where we'd encourage organizations to be creative about covering things that may be considered admin fee related. The other thing that there's places in here like onboarding or training staff, there's actually administrative costs, administrative items here. We will be coming out really shortly and we'll update our FAQs here shortly on the staffing fee. You can see that staff are limited to a time period of 18 months. We've confirmed with almost all the CCOs and we've asked the CBOs that have applied last year, seems to be overwhelmingly that they would like clarification on is what does it mean 18 months? And what we're going to come out with here, I expect on Monday, is that means 18 months full-time equivalent. So for example, if you have a staff person working, I'm gonna do some live math here, so we'll see how this goes. But if you have a staff person working quarter time in CCBF, then you can cover them a quarter of a time for 18 months times 4, if that makes sense, right? So, or let's do 50%. 50%, 18 months plus 18 months, 36 months. So you could cover somebody for 36 months if you're only covering 0.5 FTE. If you're covering them for a whole FTE, then you are limited to 18 months, but it's basically going to be 18 months full-time equivalent. So that allows organizations to draw out the CCBF funding at least until the end of the demonstration, which is September of 2027. I see questions in the chat. So I just want to make sure. Okay, thanks. Thanks, Heather. Appreciate that. Okay, so a couple of other things that I wanted to pull up is the budget this year. We heard a lot from folks that our budget last year really wasn't kind of typical of a community-based organization or a grant budget. So we've added a number of things in here this year that hopefully will be really helpful. Firstly, at the bottom, if you can see it here, there's an instructions tab. Each line by line has instructions about what to put in the line on the budget worksheet. And then there's also an example budget. And what looks a lot different than it did last year is we have these budget categories that organizations are more used to. So the categories are salaries, fringe, equipment, technology systems. There's even a other category. And then there's areas to when it may be needed, there's areas to even include a narrative in here. And there's also some opportunities in the application to write a narrative about the budget itself. And then there's the actual budget worksheet. What's maybe a little different in this budget is that for each area, you need to call out what allowable use type in CCBF that line item could be attributed to. We realize it's a little vague, but do your best. And then what happens is at the bottom of the budget, let me go over to the example budget. At the bottom of the budget, those totals in each allowable use will be added up for you. And this is kind of what's important, what the CCO has to tell OHA they're giving out the money on. Okay, so that's a lot. I think I just have, let's see. Oh, wrong slide, sorry. Find my slides, where are my slides? Okay, here they are. Okay, where were we? Okay, so that's the application and budget template. And then I'll drop in all the links. We've got our OHA CCBF webpage where you can find the application and budget templates. Those are, maybe I didn't mention this, those are uniform across OHA. So while a CCO may have a different process for submitting the application and budget, a few of them have portals. The budget and the application itself are the same across the state. So that means that if you're applying to multiple CCOs, you'll use the same application and budget. You may need to change. There are questions if you're applying to multiple CCOs. You will need to call out how you're using the funds differently. We also have our new requirement this year where if CCOs are going to grant an organization either less money than the organization asked for, or the organization asked to apply across multiple CCOs, the CCO is required to reach out to those grantees, those applicants, and meet with them to talk about what would it mean if you asked for $100,000 and we gave you $75,000, to understand both ways so that you have an idea of what they want to fund you, and it's not just a surprise when you get half the amount that you asked for, and that you have a chance to update what you're asking for given what they're saying they may fund you for. Oops, and then there's our contact information. So let me stop sharing and I will drop in a whole bunch of the links that I shared. And I'm more than happy to answer any questions.
Thanks, Suzanne. Reminder for folks that the links that are being shared, the slides from the presentation will be shared out, and I will also be putting those individual links in the body of the follow-up email for folks. So please grab them in the chat. Suzanne's going to share if you want them more timely. Don't want to have to wait for that follow-up email, but please know that those will be coming your way again. And I wanted to take a second and give folks an opportunity to ask Suzanne any questions. I know that y'all have been here long enough that you know Dolly has said, we want you to know when there's funds to do the good work. And so we wanted to start us off with Suzanne, and then real briefly, Shauna, I see you're here. So if you want to get queued up for our second presentation, we'll take some questions from folks if they have them.
There's a great question in the chat around the impact from current administration funding cut on this program. Thank you for the question. As at this point, we don't expect that the funds were already allocated. They're what's called DSHP funds, Designated Health State Plan funds. And it's a match with the federal government, and we don't expect this CCBF funds are already allocated. We don't expect any impacts on the changes, but we all know that never say never, but there is no expectation at this point for any impacts. Thank you.
Yeah, thank you, Suzanne. And again, reminder for folks, contact information for the presenters will be sent out as well. So if you are a person who needs a little more time to process a question you want to ask, or if you'd like to have a one-on-one conversation with Suzanne, that is also will be an option. And you are welcome to reach out directly to her. So with that, I'm great at segues today. With that, Shauna, you are here. Hello and welcome. I'm just going to go ahead and pass it over to you. You have the rest of the hour, and I know that folks are really excited to hear about this. Heard about the other waiver benefits throughout last year, and this is the one that folks are ready to hear about when it went live. So please take it away.
Oh, thanks so much, Heather. And Suzanne, thank you so much. That was awesome information. Really appreciate sharing the space with you today. So, um, okay. The nutrition, the health-related social needs, nutrition benefit is we're still creating it. So bear with me, but I'm certainly willing to share what I can. I'm Shauna Kerr, I'm Operations and Policy Analyst with the waiver. My focus is on nutrition. So let's go ahead. Let me see. Let me get to the right screen here. Um, so you all are very familiar with health-related social needs, and what they are, and what the team does. But just wanted to call out a little bit here that we're changing some of the language a bit, and we're within the administrative rules and our guidance for CCOs and all of that. But housing supports also includes home changes for health. So those are the air conditioning units, air filtration, those types of things are now embedded within the housing supports benefit. And then, of course, we have nutrition benefit and outreach and engagement services. So to focus on the nutrition benefit, and for some reason when I share, then like a lot of my other functions go away, so I can't really see the chats, but just like please hop in, interrupt whatever y'all may need to do to get my attention. Just to, give a little bit of background, I've been within OHA for just a little bit over a year now. This work started way before my time, and we had a group of advisors who really helped put their arms around the benefit and created some guiding principles for us. So we our goal and whatnot is to create culturally appropriate and responsive programs, be person-centered, acknowledge the role of racism and colonialism in defining which food and diets patterns are considered healthy or unhealthy, and to really make sure that our benefit is informed by evidence and that we dispel myths whenever possible. Our goals for implementation, we've had to shift a little bit of this to really make the benefit work with the guidance from CMS, but we want to, as much as possible, use mainstream food retail channels like grocery stores and whatnot to help people get the foods they need where they usually get them. We want to minimize operational complexities, so be able to have it just as smooth as a program as possible. And really meeting the members where they are, normalizing and stabilizing relationships with food in their own bodies, decreasing social isolation, understanding support and the time that's needed to make any type of significant change. And of course, consider lived experience and what's going on during their current life transition. This is just a little bit more about food and really looking at food as nourishment. That, so often this is a way for us to connect. Think about the different holiday traditions that you might have that revolve around food. Maybe a bunch of people in the kitchen together prepping a meal or, sitting down and celebrating graduations and all those things that we do together. Food can really lessen isolation. It's a way to show love, build memories, help connect with our body cues, and of course, improve our physical, mental health and well-being. A foundation for our program is really around trauma-informed nutrition, and um, and this will be a kind of a training that we're going to provide in the future. But, really want to know, does the food assistance reduce shame, anxiety, confusion, and tension? Does it promote safety, dignity, and joy? And does it inspire healing and a healthy relationship with food? Because so often when we experience trauma, food can be triggering. And and so it's, really uh, being able to understand that as we deliver the benefit. So this is a quick overview. We launched some of our nutrition benefits this past January, so we're still very new. But assessments for medically tailored meals, a medically tailored meal program, and nutrition education. And because medically tailored meals are very clinical, actually, some of this is uh, like reimbursed and funded through Medicaid versus HRSN. But a member would ideally they'd be working with their provider. Their provider would say, "Hey, we have this great benefit. I think that you might really benefit from this. Would you be willing to work with a dietitian if you're not already?" And then the member works with the dietitian and they, see um, if their condition would possibly improve through medically tailored meals, and then that dietitian would then do a handoff through the CCO, um, or open card to be able to have the member work with a medically tailored meal provider. Then they would get more than likely weekly meals delivered to them that are specific to their individual needs. And so I'll talk a little bit more about medically tailored meals in a minute. But that's, a bit of an overview there. And then we have nutrition education. This really it depends on CCO what the exact offerings are, but as kind of broad guidance, we provide broad guidance to nutrition, provide encouragement and tools to help create a positive changes around food and nutrition that the member might be seeking. So, our future benefits, we are in the throes right now of creating our fruit and vegetable benefit. Hopefully, we're going to launch sometime between October 25th of this year, or excuse me, October 1st of 2025, and then between June of 2026. So, we're just trying to get everything in line so that everybody's ready to go. We're expecting a large volume with medically tailored meals and even nutrition education. We're not expecting a huge uptake of that benefit. But with our fruit and vegetable benefit, we are expecting a lot more members will be eligible and will actually choose to receive the benefit. So, um, it could be money that the member would receive on a voucher, card, farm stand, vouchers, those type of things, or something like a produce box, a CSA share. It just depends a little bit about where the member is, what their needs are, and what kind of vendors are available to provide the service within their service area. So a lot more to come on that. But then we also are expecting in 2026 to have our pantry stocking benefit launch. And so we're working with many of our technical partners within the state to make this happen, to where funds would be loaded to the SNAP card and for grocery purchase. And the only folks that are eligible for this particular benefit will be pregnant individuals, children, and then youth with special health care needs.
Hey, Shauna.
Yes.
I wanted to make sure I waited until you finished your slide. We do have a question in the chat. Is it all right if I ask it
Oh,
to you now?
please.
Okay. The question is, are the requirements to receive the nutrition benefits the same as the housing benefit?
Um, no. No, but I pause on that because there's a lot of similarities. So let's go through. I think we'll answer that fully um, uh, when we get through the eligibility. And oddly enough, eligibility for each of the nutrition benefits are a slight bit different. So we're working on that to make the benefit a little more seamless and easier to deliver.
Great. And there is one more question in the chat, but I'm going to hold it as
Okay.
we get closer towards the end, because I think that's kind of a large group conversation question. It's really good. So go
Oh,
ahead and I'll
cool.
flag you if there's another one.
Oh, thank you. Okay, so our eligibility for nutrition, first you need to be an OHP member and then be in the covered populations and then be eligible for the individual services. So we'll go over that here in a second. Um, so just a different way to kind of say some of the same things is member needs to be an OHP member, part of HRSN service covered population, meet the specific HRSN clinical risk factors. So for medically tailored meals, the member would also need to qualify, be on the prioritized list that would qualify for medical nutrition therapy. And if the member wouldn't qualify for medical nutrition therapy, more than likely, the medically tailored meal would not be of assistance to them. So there's some nuances there that we're kind of wading through with all the different partners. For nutrition services specifically, across the board, the member needs to meet the definition of low food security by a USDA low food security screener, and we're utilizing the six question short form screener. And so, maybe they have all these other factors, but they don't meet low food security, then they wouldn't be eligible. So they do need to meet that low or very low food security. So these are our covered populations. And this is really simplified, but young adults with special health care needs. And some of our populations are also the clinical factors in some of our benefits, so it gets a little confusing. But that's okay. That could be a win-win for a member. And then adults and youth discharged from residential mental health or substance use programs, adults and youth released from incarceration, individuals involved in child welfare, individuals transitioning to dual status, and individuals who are houseless or at risk of houselessness per the HUD definition. So here's our eligibility for medically tailored meals, or MTMs, as we refer to them. One of the kind of nuances here is that medically tailored meals is only at the individual level, so it's not at the household level. And they're really the intention, they're targeted more towards adults, and with with defined chronic conditions related to nutrition. And so we'll get into that in a little bit here with a bit of an example. But medically tailored meals are also not allowed for those that are living in facilities that include meals. And we're having some conversation about that right now. But in general, facilities that include meals will be able to adapt to the different nutrition needs of that individual. So if they meet the general eligibility, be screened as having low food security, and then have a current nutrition care plan from a registered dietitian that recommends medically tailored meals. And that medical piece is very important for this particular benefit that is not as doesn't play out as well for the other ones, which I think is a good thing for members. So if we take a case example, and we'll kind of move through this quickly, but we have Alex here. They were released from a state prison about 6 months ago. He lives in a single occupancy room unit, and Alex has damage to his kidneys and it's getting worse due to poor health. Alex struggles to have energy to make his meals. He doesn't have access to the foods that we think that might help him become healthier and have some more energy. So after a few visits to urgent care, he's working with his primary provider to stabilize his condition. And so this is a little bit of a workflow to where the doctor, like notices things are going on, says, "Hey, medically tailored meals might be a benefit for you. Would you consider working with a dietitian?" Alex is like, "Yeah, I want to feel better." So meet with the dietitian, they create a plan, and then Alex reaches out to the CCO, and they put in the request, it's approved. They connect Alex with the medically tailored meal provider. Alex gets the medically tailored meals, and it's working well, and able to, gain strength and then work with the dietitian around like how can I do this without these medically tailored meals? And so that's a little bit of a view of a journey with somebody for medically tailored meals. For nutrition education, the eligibility is opened up quite a bit more. It's, meet that general HRSN eligibility, be screened as having low food security, and have an interest in receiving nutrition education. So that's let me go ahead and go through a few more things around requesting HRSN services, which I know you're all familiar with, but it's just good to have in mind. There are a few things on the slide that we do need, or CCOs need, to be able to receive a request and move through the approval process. And as for nutrition benefits, if you're an open card member, we have the information here. If they're a coordinated care organization, we have the information here. Our website's really fleshed out with information on how to reach out to your CCO or open card. And so some of those links are embedded here. And then, so of course, a thank you for having us today. And then we have some resources in the appendix. So from there, I'm so curious about this question that we have that's pending.
Yes. Thank you, Shauna, so much for coming and giving some more detailed information. Every benefit that has rolled out, we've had someone come and present to kind of put the puzzle pieces together to make a more full picture. So this is we were told like, oh, the nutrition benefit info is coming. We'll have more information. So thank you for being the one to bring that to this group. I see two questions from the same person who's here today, sharing space with us. The first one is, what role do CBOs play since the state has the infrastructure like SNAP cards? And so that was the one that I was hoping might be for the large group as well. Like, what roles do CBOs play when it comes to this benefit, knowing that it's going to be through Medicaid and through healthcare providers?
Yeah, that is a great question. And in short, it's only the pantry stocking benefit that'll be on a SNAP card. And so, there won't be a huge volume there, but the outreach and engagement piece would be very important for those members to help identify members if they, might qualify. And so I think that that's where our community-based organizations really come in, is with that outreach and engagement piece of it. Also, nutrition education is a place where um, community-based organizations come into play, and that would be able to connect with the pantry stocking benefit, fruit and vegetable benefit, and medically tailored meal benefit. Some of our community-based organizations are the medically tailored meal providers. And so there's a space there if you're currently doing that. Then I'm happy to kind of help you make the connections to make that happen, to be able to provide this benefit that way. And the fruit and vegetable benefit, depending on how it's going to be rolled out, certainly outreach and engagement, certainly tied into nutrition education. What do I do with this box of fruit and vegetables? I don't know. And so there's different ways. It might not be providing, the exact like SNAP card to a member. That probably wouldn't be how it would go. But again, the SNAP card interaction is only with a very small slice of the benefit.
Thanks, Shauna. There is one more question. And also, we are open to, if you don't have the question, someone does, and we will make sure that we get that answered to folks as well. So no pressure. But when the person who asked the question is saying when they support families with housing needs, those families also tend to have food security issues. Sometimes they have to use their own funds to order food and deliver it to them. Why not incorporate this into the housing program? Since they're seeing a connection between those two needs.
Absolutely. I think that that is an amazing conversation to have. And, in short, we're looking at that. How can we weave this in? That's where our outreach and engagement, community-based organizations can help connect those dots. And as we roll out these programs, we'll be able to weave them in to the housing program. Fairly seamlessly. It's just as getting things up and going and on the ground has proven to be difficult for sure.
Great. Yeah, and there's a shout out and an idea. It says they're working really closely with Meals on Wheels right now, particularly in Southeast Portland. I hope they're a big part of this program. And I think about that medically tailored meal
Mhm.
piece. I know I volunteered with Meals on Wheels as a teenager with my family. And so I know that is probably a partner that is a part of these conversations and being able to help make sure that folks are getting this nutrition benefit. That's an assumption. If I'm wrong, please correct me. But
Oh no, yeah, our Meals on Wheels people are just absolutely amazing. And they're they're so flexible. They're bending over backwards to make everything work. They're also one of our partners with the fruit and vegetable program, and will be able to deliver produce boxes. So yeah, we're looking forward to more work with them.
Amazing. Well, Shauna, it is 11:59, so you nailed it on the timing. Please, folks, if you have more questions, we are going to make sure everyone's contact information is sent out. If you would like to have longer conversations with our presenters, please do. They have a wealth of knowledge, and they are excited to continue to make sure you know what you need to know to continue to do the good work that you're doing in your communities. This is it for today. But I want to just remind folks that for our next public health modernization chat in May, we're going to be talking about the state health assessment and the state health improvement plan. You've heard us talk about SHOT and SHIP. The new state health improvement plan will be launching this year. So folks who are curious to get more information about that and know, figure out where they might see themselves working in that larger zoomed out picture around overall state health, that is going to be a conversation you don't want to miss. So thank you for coming today. Thank you to our presenters, Shauna and Suzanne. Thank you to all of you who showed up to be a part of this conversation and continue learning with us. And we will see you next time.